Building a rapport, relaxing the patient. A good communicator will be able to relax and anxious patients and increase patient satisfaction with the eye exam. There are many ways to relax a patient and build a rapport, and these include: A. Provide information about the eye examinations prior to the appointment, as this can reduce anxiety and improve satisfaction with the consultations. B. Provide a comfortable and welcoming setting in the practice waiting room, comfortable chairs, a selection of magazines. C. Your tie is important, and medical research suggests that patients prefer a formal, professional appearance. The first impression counts, and some practitioners like to greet a patient by name and escort them to the examination room. E. Beware of making the examination room frightening to the patients. F. Change the chair height to ensure you are at the same level as the patient. G. Some practitioners like to chat about non-clinical issues with the weather, holidays, sports team, parking, etc. prior to the examination to help relax the patients. In this respect, it can be useful to make a note of any relevant information: a child's favorite sport, sports player, team author. Your posture and style should be relaxed but attentive. Maintain regular eye contact and use the patient's name at appropriate time during the eye examination. An open question is typically used to start the case history, as this allows the patients to tell you about any problem with their vision or glasses. A balance is required between allowing the patients plenty of time to discuss their problem and not rushing them, but at the same time retaining control of the discussion. You need to ensure that the patient feels that you are fully listened and understood their problems, and you may even need to allow the patient to talk about information that you know is not necessary from a diagnostic viewpoint. However, you also need to develop the skill of being able to interrupt an overly talkative patient without appearing rude. J. Some patients are very shy, and open questions provide little information and may make the patient feel uncomfortable. Closed questions can be useful at the beginning of the case history with such patients. Listening is a hugely important communication skill. It is vital that you have fully listened to the patient and understood their problems. There are a variety of ways that indicate to the patients that you are listening, and these include maintaining eye contact and demonstrating attention by nodding and or using affirmative comments such as "I see," "I understand," "Okay, go on." Listening is also indicated by using follow-up questions to comment, such as asking about the locations, the onset, the frequency, etc. of headaches, when the patient indicates that they suffer with them. Finally, summarize the patient's problem at the end of the case history. It's a very useful way of indicating to the patients that you have fully listened to what they have to say and fully understand what problems they are having, while it also provides the patient with an opportunity to inform you if you have missed anything. Provide a brief explanations to the patients of each test that you use during the eye examinations. Suggested information in lay term is provided for each test described in later chapter.